Hello and welcome to tonight's episode of Dr. Melissa Medicine Woman. Did you know that 34 million people are affected by this condition? 34 million Americans, let's say that. That's just in America. What are we going to talk about tonight? We're going to talk about diabetes. Now, we talked about pre-diabetes in another episode, and more than 84 million people have pre-diabetes. But we're going to talk tonight about the ins and the outs of diabetes and kind of what it is, if you have it, what to expect, how to kind of screen for it. So before we get into all of that, let me go ahead and read you this disclaimer that I do share on every show. So this show and all the content are for educational purposes only. It's not intended to diagnose, to treat, to cure, to prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult with your physician, pharmacist, or other qualified healthcare provider with questions that you have about your medical conditions before starting or using any dietary supplements, any herbal remedies, any exercise plans, or nutrition plans. And I will tell you how you can develop a relationship with me, your concierge pharmacist. So before we do talk about diabetes tonight, and I did title it Diabetes 101 because I wanted to again give you the ins and the outs of a little bit about diabetes, what you may or may not know. And then we're going to get more in depth into it in our next episode of other things that can be done. So who is Dr. Melissa Medicine Woman? Well, Dr. Melissa Medicine Woman, I am a concierge pharmacist. I have over 52,000 clinical hours in the healthcare arena, working with both Eastern and Western medicine. I speak to hundreds of patients a week. I have saved more than 1,000 patients' lives. I help thousands and thousands of patients optimize their health by getting to the root cause of the problem and figuring out what is right. Is it time to ditch the pills? Are they taking the right medication, the right supplement? And so that's one of the reasons I have the knowledge to talk to you tonight. And I want to say thank you so much for tuning in and joining me and coming back each and every week. It's a pleasure to have you here with me. So let's get into the crux of Diabetes 101. Well, what is diabetes? Well, diabetes is classified as a chronic or long-term disease. So something that happens and stays with you. It is marked by high sugar levels in your blood. Okay. Now, this can be caused by little or no insulin at all. So insulin, it's a hormone that is produced by your pancreas, and it's used to regulate the blood sugar. Okay. And sometimes diabetes is caused because you're resistant to insulin. Now, when you're resistant to insulin, it's when your body cannot effectively use the insulin that is there. So what happens when you have diabetes? So if you've been diagnosed with diabetes, so if you're one of these 34 million Americans and you've been diagnosed with diabetes, what happens is that sugar, depending upon how well you are able to, if you're not able to produce the right amount of insulin to handle it, or you're resistant to the insulin that handles that sugar. So over time, diabetes, what it does is it can break down your organs. Okay. So diabetes in itself puts you at risk for having heart problems. It puts you at risk for having eye problems, kidney problems, lower extremity problems, especially you've heard of people having to have, maybe you've heard of people having to have their feet or their foot or their lower leg amputated because of diabetes. So let me kind of break this down into a real world example. So when you have a stack of pancakes and you pour that syrup over the stack of pancakes, and that syrup is getting all in those pancakes and it's making them nice and mushy. Okay. So those pancakes are getting nice and mushy, and they're easier for you than, they're loaded with sugar. So what happens is diabetes does that to your body, to your organs. So that stack of pancakes that becomes loaded with sugar and starts to deteriorate is exactly what diabetes does to your organs, to your heart, to your kidneys, to your extremities, to your eyes. It starts to break them down and they're not working as efficiently. Now, there are a couple of different types of diabetes, and I want to talk about the different types. So type 1 diabetes, most often diagnosed when you're younger. Okay. So type 1 diabetes is an autoimmune disorder. Now, what this means is that your body, autoimmune, so your body is acting against itself. So the body destroys the insulin producing beta cells. Okay. And then without insulin, your body is unable to use the glucose or the sugar to convert into energy. Okay. So that's type 1. Now, that most often diagnosed when you're younger, but it can be diagnosed when you're older. Now, type 2 diabetes is the most common form of diabetes in America. Okay. And it's a condition where your body just doesn't make enough insulin to control the blood sugar, or the body can't effectively use the insulin. So what we talked about earlier, the insulin resistance. So you're not making enough, or your body's not using it properly. Okay. And without that insulin, your body is not able to convert the glucose or the sugar into energy. So we need sugar or glucose. Our brain feeds on that. Okay. But without the proper amount of insulin, you cannot convert it to the energy that's necessary. So type 1, autoimmune, type 2, most often preventable and controllable. Okay. So with type 2, often a healthy lifestyle change, especially if you're pre-diabetic, or even if you're diabetic, a healthy lifestyle composed of movement, watching what you're eating, looking at your nutrition that you're consuming, and sometimes we have to add medication. But when we look at what we're trying to do for our whole body, so whole body health is one thing that I offer, and whole body health is a great way to help you with your diabetes, or if you're pre-diabetic, to help you on that track, to get you started on moving more, eating a more nutritious consumption. But you also have to remember, you have to eat for your body type. Everybody is not the same. And I think that's where sometimes we cringe, or we don't understand, because we say, oh, this diet worked for my neighbor or my friend, but I'm not having any luck. I hear that so much. Well, that's because you have to eat for what your body type is. So we each have our own unique body type, and we metabolize things differently. So when we're looking at how we're metabolizing things and how we're able to control our weight, which is one thing that is helpful to be controlled with diabetes, and being overweight or obese does put you at an increased risk of developing diabetes. Now, not all diabetics are overweight, but it does make you at risk, especially for type 2. And we'll get into excuse me, a little bit more on the crux of everything. I talked to a lady earlier today. She was diabetic, and she had some complications. She had blood pressure issues, and she had recently lost over the course of several months, let's say that, she had lost over 60 pounds. And we were able to reduce some of her blood pressure medications, and we were able to reduce some of her diabetic medications. Now, she's still on some of them for right now, but eventually she might be able to get off of those. Now, the other thing, as we're talking about women, is I wanted to bring up gestational diabetes. Now, gestational diabetes is when diabetes develops when you're pregnant. So sometimes what happens is when you're carrying that baby, that it could put you could become diabetic. And this happens a lot. And we test for it. So that's one of the routine things that we do test for when you're pregnant. And so I want you to make you aware that that is something that is a possibility as well as gestational diabetes. And we'll talk a little bit more about what the risk of that is for your baby. Most of the time, if you are gestational diabetic, so mom carrying baby develops diabetes, okay, needs to be treated during the pregnancy. After she gives birth, then we check her again. And sometimes the diabetes goes away, sometimes it doesn't. It just kind of depends. A lot of the time, I would say the majority of the time, it does go away, but not all the time. So it's still possible. Okay. Now let's talk about, I did talk about the risk factors. So one of the risk factors for developing type 2 diabetes is being overweight. So if you are overweight, and we talked about risk factors even for pre-diabetes, there's 84 million people who have pre-diabetes. So make sure you go and watch that episode so you can learn specifically more about pre-diabetes. But here's the thing. When we're looking at risk factors, is we look at age, we look at weight, we look at ethnicity, and we'll drill down to all of these in just a couple minutes. But when we look at diabetes specifically, and I did say type 2 is the most common form, okay? And it actually occurs in 90% of patients. Now, there is an additional 7 million people who have diabetes who are undiagnosed. Now let that sink in. You could be going around and you have diabetes and that sugar is just melting away your organs like it does that stack of pancakes, and you don't even know it. So let's get you tested, okay? So we want to make sure, I'm going to talk about how to screen or test for diabetes in just a minute. But I want to drill down into specifics about diabetes. Now, the American Diabetic Association, they have some things put together so that we can, because we want to prevent, this is such a huge thing, and 96% of the time it's preventable. It's preventable, okay? When I talked about pre-diabetes, go and watch that. Diabetes accounts for roughly $327 billion. That's the cost of diabetes in the United States and some of the pre-diabetes. And then that includes testing, doctor's visits, things that go wrong, and medication. So when your body's breaking down because that sugar is melting like it melts that stack of pancakes, it's melting your organs, you're having complications, and that costs money, okay? Now, who should be screened? So 7 million people are walking around and don't even know they have diabetes. So let's get you screened. Let's find out if you have diabetes. Let's find out what we can do for you, okay? If you have pre-diabetes or diabetes, let's get you started on a plan. Let's get you started on whole body health, moving more, consuming the right food for your body type, and getting your sugar levels down, okay? So if you have symptoms, so some symptoms, so let's talk a little bit about that. And I bring up my cheat sheet here to remind me. So some signs and symptoms that could mean that you could be experiencing diabetes and you need to go get screened. Increased thirst, okay? Frequent urination, extremely hungry, like unspeakably, unexplained weight loss, fatigue, irritability, blurry vision. Oftentimes your eye doctor, as they're checking your eyes, will notice if you have diabetes, sometimes even before you've been screened by your primary care physician. If you have wounds that are slow to heal, that could be a sign or a symptom that you might be diabetic. Okay. So if you have any of those symptoms or signs that I talked about, now those are not specific, which means they do not specifically say you're diabetic, because those signs and symptoms could be of other conditions as well. But these are some of the things that are, that could be. Okay. And so I want you to go and get checked. All right. Now, I used to do diabetic screenings, and we would have people come in and we would check their blood glucose level. Okay. And also we can check an A1C, which is the long-term measurement of 3 months, kind of what your blood glucose level is within your body. Now, if you, so for screening for diabetes, we usually screen anybody who's over 45 should be screened at least every 3 years, depending upon what their results are, to check to see if they're diabetic or becoming diabetic. You have a risk factor and should be screened if you have a first-degree relative who has diabetes. So you have a familial history, your mom, your dad, your brother, your sister, those first degree. Okay. Now, if you're overweight or obese, especially Americans and Asians, then that does put you in additional risk for diabetes, and I would recommend that you do get screened. If you have a history of cardiovascular disease, so you already have some heart issues, then we need to screen and check you for diabetes. If you have high blood pressure, so your blood pressure is above 140/90, okay, consistently. If you're being treated with medications and it's still that high, we need to chat, because we need to work on that. The new guidelines for blood pressure, controlled blood pressure with medications, need to be less than 130/80. Normal blood pressure is 120/80. And we can talk more about that in another episode. We'll be talking about specifically about high blood pressure. Now, if your cholesterol level is high, so your bad cholesterol, your LDL, we want that number to be lower. Your HDL, we want that number to be higher. And if your triglycerides are higher, so if your triglycerides are above 250 or your HDL is less than 35, so that's that good cholesterol, then that's a risk factor and we want to screen you for diabetes. If you're physically inactive, then we need to screen you for diabetes. Okay. Screening. What does that mean? We check your A1C, which is that 3-month conglomeration of how your blood sugar has been doing. We do a fasting blood sugar test. So like I said, when I was doing those screenings, people would come in, we would check their fasting, which means you have not eaten, so you haven't eaten for 12 hours or 2 hours or however many hours. When we're doing these screenings, we need to know fasting ideally should be 12 hours or more when you're going to get lab work done. There's different levels based upon how long you've been fasting as to what your blood sugar will come back at, okay, and be normal or not normal. Now, there's also what's called the oral glucose tolerance test. Now, this is the test that's most often done when you're pregnant, and we're checking to see if you get gestational diabetes. So it's a test where you have to come in, you go to the lab, and they have you drink a sugary drink, and then 2 hours later you come back and they draw your blood again, they check you. And so we see based upon those 2 hours how your body reacts to that very sugary drink to see whether or not you have gestational diabetes. Okay. when we're checking your A1C, if your A1C is between 5.7 and 6.4, that typically you're usually in the pre-diabetic range. So we talked about that before. Now, if it's over that 6.5 or more, that's typically when we start diagnosing with diabetes. Okay. And when you've been diagnosed, and then we're checking your A1C routinely, we want it around 7. I was talking to a client earlier today. Her A1C used to be at 11, and we've been working, and she's got it down to an 8 after several months with eating the right foods for her body, eating healthy, nutritious foods, doing a little bit more movement. And she is, yes, taking some medication, but we're starting to back down on that medication because she's doing so well with her lifestyle change. Now, here's also what could put you at risk. If you previously had gestational diabetes with your first child, then we need to check you again, and we need to check you at least every 3 years, okay? Because what happens is that puts you at that higher risk to develop it later on in life even. Now, women, let's talk about your kiddos. When should we check your kids for diabetes? So when we're looking specifically for type 2, which is the lifestyle can be changed, often can be based upon obesity, which obesity has risen in the United States. Usually we check after 10 years old or the onset of puberty, whichever occurs first, okay? Now, children especially have a risk factor if they have a family history, first or second degree relative. So this could go all the way back to grandparents, and their mom had gestational diabetes with them. That puts them at risk, okay? Now, also kiddos have ethnicity risk factors. So Native Americans, Latino Americans, Asian Americans tend to put children at a little higher risk. And so those will be ones that we want to screen. Okay. Now we talked about pregnant women already and the glucose tolerance test. Now this test, just to let you know, it usually happens between weeks 24 and 28 of the pregnancy on average is when we start testing for that. And like I said, children of moms who had gestational diabetes do have a higher risk of developing type 2 diabetes. So we want to make sure that we do screen those children. Okay. So we talked about type 1 and type 2. So let me give you just a little bit different breakdown of what type 1 and type 2 is. So type 1, I spoke about the beta cells. So the beta cells are in the pancreas. And the pancreas is where you produce insulin. Okay. So type 1, the autoimmune disorder. So your body's acting against itself. So the beta cells in your pancreas make little or no insulin. And so what's required is that you usually have to have daily insulin to sustain life, right? Because we need insulin to break down the glucose to convert it to energy. Okay. Most often, these type 1 patients, they have to have the injection of insulin or they have an insulin pump. Okay. And we'll get into medications next time. Not going to really get into that of it right now, but just to let you know, type 1 is because your body is not producing the insulin because your body's acting against itself. And so it's making little or no insulin. So autoimmune disorder. Type 2, the most common, 90% of those 34 million people who have diabetes have type 2. 7 million don't even know it. Usually occurs in adulthood. Okay, type 2, I may not have said that. Usually occurs in adulthood. It can sometimes in children, and we talked about the risk factors for children. Now, what happens with type 2 is that this is where you have progressive loss of the beta cell insulin secretion, okay, combined with usually insulin resistance. All right, so those couple of things lead to development of type 2 diabetes. Now, type 2 diabetes, we talked about screening for over age 45 and up, or unless you have risk factors. And that's because as we age, we're more susceptible to developing diabetes. Obesity, we're more susceptible to developing diabetes. We have poor diets, so we're not eating the foods that are nutritious for us, or we're lacking exercise. Those are all things that put us at risk for developing diabetes. And as I said earlier, some of the things that we can start now, working on our whole body health, working on that nutrition, eating right for your life, for your metabolism type, getting some movement in, and also doing some other things with gratitude and mind management, as far as like meditation, sitting down and journaling, some great things to do, because when we talk about whole body health, we talk about physical, mental, spiritual, and emotional. And so I do want to offer this to you. Let me throw this link up here. Let's see, sorry. And I want to share with you. So drmelissabalizan.com/whole body health, WBH. WBH. That is the way to get started on whole body health. So that's a step in the door for if you're already diabetic and you're trying to work on changing these lifestyle and get off of your medications, and you want to do different things. So I have programs that we can get you started. And so drmelissabalizan.com/whole body health. That's your next step, is to go and sign up there. And you get a bonus. We'll talk about your medications. We'll sit down and for 30 minutes and we'll talk about the medications that you're taking currently. Are any of them putting you at risk for developing diabetes? Are any of them things that you want to get off of? Okay. So what causes diabetes? Well, we talked about the autoimmune response. We talked about the insulin not working. What happens? Okay. So when you're digesting your food, so when your food is being metabolized and digested, the sugar or the glucose, it enters your bloodstream and it serves as a source of fuel for your body. Okay. I remember I said that sugar is necessary. It's our brains love sugar. Our brains feed on sugar. Okay. And the pancreas, which is that organ that's in the stomach, produces that insulin. And when it's not producing enough insulin, or it's insulin resistant, so your body's not able to utilize it to convert the sugar into glucose, or the glucose into energy, then that can make you form what's called diabetes. So insulin is very necessary for our cells. It helps move that glucose or sugar in the bloodstream. Okay, it moves it to your muscles. Your muscles need glucose. They need that sugar to burn off. Okay, certain cells need that as fuel. All right, but people who have diabetes, your pancreas isn't either producing enough insulin, or your cells are not able to utilize it correctly, and therefore we're not getting that glucose, that energy, to the muscles. We're not getting it to the brain. We're not getting it to the liver, and we're causing problems. Okay. So we want to correct that. And so we can correct that with changing the way that we eat, developing some good, healthy exercise or movement habits. Sometimes medication is necessary to cause the reversal and be able to get the insulin used appropriately to convert it to energy, to convert the glucose to energy and push it into our cells so we can use it appropriately. Okay. So that's diabetes 101. That's a lot, right? Okay. So if you are diabetic, then I encourage you to start whole body health. Let's start working and getting you down to the bare minimum of the medications that you're taking. If you are pre-diabetic, let's start whole body health and get you down to the bare minimum of medications. Let's start working on those lifestyle things. Get you started being healthier, eating the right foods, being nutritious, more nutritious meals for your body. Because imagine if that stack of pancakes is your organs and you're diabetic. And so that's exactly what it is. That stack of pancakes with the syrup melting in and deteriorating the pile of pancakes. That's what diabetes does to your organs and to your body. Okay. So to recap, we talked a lot of different things tonight about diabetes. We talked about that there's type 1 diabetes, which is an autoimmune disorder, most often diagnosed when you're younger. Type 2 diabetes, which is 90% of the 34 million that have diabetes. 7 million are running around, don't even know they have it. Type 2, most often in adults, most often older, but it can be in younger children. We talked about symptoms, okay? Now, these symptoms are not specific to diabetes, but they're a cause that you need to get checked out. Increased thirst, increased urination, fatigue, increased appetite, blurry vision. Here's a couple more: nausea, vomiting, weight loss. Now, this is usually weight loss despite an increased appetite. We also talked about gestational diabetes. And gestational diabetes is when the mom who's pregnant with the baby gets diabetes when she's pregnant, okay? And we check for that usually at weeks 24 to 28. And when mom has diabetes, that puts the child, once they're born, at risk of developing diabetes, and mom may get better and not have diabetes anymore after she gives birth, or it may stick with her. Sometimes it sticks with her, but she should be screened every 3 years to make sure that she's getting better. And when we do screenings, we check that A1C, we check a fasting blood glucose, and we want to make sure that we're getting you to the right numbers, okay? Gestational diabetes, we typically do the oral glucose tolerance test. Now, sometimes your physician will do an oral glucose tolerance test, even if it's not gestational, but rarely, okay? And those numbers, so A1C greater than 6.5, you're usually diagnosed as diabetes. Between 5.7 and 6.4 is the pre, so you're at risk. You're not quite diagnosed yet, okay? And go and watch that episode on pre-diabetes so you can learn more about that, okay? Now, I want to talk more about the medications the next time we meet, so we will discuss the medications that are involved. But right now, I just want you to know that if you are diabetic, it's not something that you have to give up. Certain things you can still eat most things as long as you're eating the right nutrition for your body. And we can control your blood glucose levels with what you're eating and how you're moving. That makes a difference, okay? So I also want to talk briefly, because if you're diabetic, what can happen is you can go the other extreme. Your blood sugar can drop, and we want to make sure that you're protected for that as well. So when your blood sugar drops, okay, so it gets too low, that puts you at risk as well. Now, some signs or symptoms that it might be going low, you definitely want to check your sugar, okay? But it might be going low. you have a headache, you're hungry, you feel shaky, you're weak, you might have sweating or irritability, and difficulty concentrating. You're like, oh, can't concentrate. Those might be some symptoms of your blood sugar going low. Okay. So if you have been diagnosed as diabetic, you always need to keep some source of sugar close by you. Okay. Now we do make like glucose tablets, glucose gel, having hard candy around, orange juice. Orange juice is a great one. We use that a lot to bring up a low blood sugar. So I want to make sure that you're safe because we don't want you dropping too low either. So they can go backwards and forward. So keeping you at the right level is where we want to keep you. So I hope you've enjoyed this episode tonight, and I've been able to give you some information on diabetes, some of the symptoms of diabetes, some things to watch out for, especially if your sugar goes too low or too high, both ways. Understanding that there is ways to control your diabetes, things to do with movement and nutrition, eating the right foods for you. You don't have to give up things completely, okay? It's a balance, and sometimes medication is necessary. And we will talk about medication next time. But I want you to imagine, okay? Imagine that stack of pancakes. Think of what that's doing to your body. And so let's correct that as best we can so that it's not affecting all your other organs. We want to treat it now so we're not deteriorating those organs, okay? Because your body, you're only given one. You're given one life. So I want you to take care of it now because the gift of health is the most amazing gift. This is Dr. Melissa, Medicine Woman. Take care and have a fabulous evening.